Hello and welcome to today's webinar. We're just opening the doors and letting attendees in. We've got a really good list of registrants today. My name's Mike Wallace. I'm Chief Decarbonization Officer at Persephone. I'll be moderating today's session with a group of experts from UCLA and SPLC, Sustainable Purchasing Leadership Council. We'll get started in just a couple of minutes as we see more people tuning in. You are welcome to chime in through the Q&A portal. We'll be monitoring that as we go, keeping track of questions. We'll be recording this session too and sharing it like we did with the last webinar. And we'll make sure that you can see and access the previous webinar too, because this is a series of stories that build on themselves towards the end of the year and also towards some key developments that are happening in the market and also here in California. So I'll give it just a few more seconds and then we'll get rolling. Again, my name's Mike Wallace, Chief Decarbonization Officer at Persephone. This is webinar number 2 in a series of 4 for this year. We're willing and able to take suggestions for future webinars as well. The next one will be on construction and real estate development. That'll be in Q3. And it ties nicely into some research that I'll talk about a little bit later on around the procurement of the state of California itself. The state of California spends a lot of money on construction, architects, design, and real estate related activities. And we'll talk about that at the very end. This particular webinar is going to dive into healthcare because in most developed countries, healthcare makes up about 20% of the GDP. So we'll get into a little bit of details of how one looks at the healthcare sector itself, who's in the healthcare sector, as well as who's in the value chain of healthcare. It's a mixture of public and private companies, meaning public as in publicly traded and private as in privately owned. So maybe not as transparent as we're used to with publicly traded companies. So we're going to go ahead and get started. I want to go first to our expert panelists that are joining us today and allow them to give quick little introductions of who they are. So Tyson, if you could go first and just say a couple minutes about your role there and what you do, and we'll come back to you when you start to present.
Yeah, thank you, Mike. My name's Tyson Timmer. I'm a PhD candidate at the UCLA's Institute of the Environment and Sustainability. I study corporate sustainability, disclosure, and measurement, and I'll be presenting a bit on some of the research I've been involved with for, the last 4 years now at UCLA Anderson Center for Impact.
Thanks, Tyson. Becca?
Hi, everyone. I'm Becca Disman. I'm a director at the Sustainable Purchasing Leadership Council, which leads a global community that advances the power of procurement for positive social and environmental impact. And at SPLC, I lead CHARM, which is an initiative I'll speak about later that brings together medtech companies and health systems to test and scale strategies to lower emissions from the value chain. And I have a background in healthcare strategic planning and consulting and convening virtual collaboratives on sustainability. And I'm based in Boston, but originally from California. So it's great to be with a California heavy panel of experts today.
Thank you, Becca. Appreciate you being with us today. Deepak, over to you.
Thank you, Mike. Good morning, everybody. Deepak Rajagopal. I'm a faculty at UCLA in the Institute of the Environment and Sustainability and also in the Department of Urban Planning in the Luskin School of Public Affairs. My background, I'm both an engineer and an economist, and I work on the circular economy, looking at the life cycle impacts of products and services from a life cycle assessment perspective, but also from an economic perspective. And I'll be talking about my work on the Scope 3 emissions of healthcare.
Great. Thank you so much, Deepak. Appreciate that. So let's take a little bit of a step back in time and look at some precedent-setting trends that you all should know about because they're no longer available on the White House website. They're also precedent-setting in that any of you dealing with struggles internally with talking to different departments about procurement or maybe legal about whether or not you can ask certain questions of suppliers, realize that precedent was set by our own White House Council of Environmental Quality some 15 years ago. This was the original scorecard that came out during the Obama administration, and it was a look at the largest suppliers to our government. And we're all taxpayers here, hopefully, or if you're in the US, you might be. And we have the right to see where our money is spent. Now, you'll see it's very heavily weighted towards heavy industry or military defense contractors, but right up there is McKesson. And then you see other companies in that list when you go to the original, and we'll give you the archived version of this. During the first Trump administration, that website went away. The website came back during the Biden administration. They updated it. It became more dynamic. And in fact, there were data services in the back end that we couldn't see in the public domain, but the White House CEQ and General Services Administration were using EPA data, and they had tables of information about CO2 equivalents or actual disclosures from the suppliers. This is an exercise that we at Persephone are doing with numerous customers as well as universities. We'll talk about the university angle in a second, since many of you come from the university background, or SPLC has connections to the university system as well as UCLA. Take it forward a little bit, just after COP and just before the Biden administration left, the White House CEQ updated the scorecard, added some new dynamics to it. We featured it in the last webinar. You can hear Katie Newhouse talk about it and how they did the research they did. The scorecard was updated, and in light of the change in the administration, we all assumed that it would probably be taken down, which it is. We have archived links to these actual websites so you can still access them and play with them. They even went so far as to break down the federal Scope 3 emissions inventory, and you can see the breakdown there of where the spend is broken out by Scope 1, 2, and 3. So as we get into this a little bit more, I want you all to think about, what can you do in this space? And what might we do as a collective body of experts who want to see more of these things and have the right to see more of this kind of data? Maybe at the state level, a little teaser at the back end, we'll talk about some state level work, but also at a public institution level. The university story that I wanted to share with you is one that we did with ASU, a red state, but Arizona State University. President Crow is very committed to carbon neutrality and becoming net zero by a certain date, like many other universities are. Through a project with ASU's professors and academic team, we got to the actual list of suppliers to the university itself. We can do the same thing at the University of California. We need to talk to the right people at the University of California, and we then need to go up to Sacramento and talk to the Department of General Services. And all of this is happening right now to possibly get the list of suppliers to the University of California. But we're going to talk about another unique list. The state of California's own list of suppliers is actually publicly available. And as a resident and taxpayer here in the state of California, I would like to know where our money is going and whether or not our own suppliers and supply chain is resilient and ready for climate change related physical risk. So we're going to go into this from looking at it from an organizational point of view. You just saw lists of actual supplier names, companies you might have recognized. And we're going to go to Tyson to explain to us what he's been up to, and also a little bit more of a focus into the healthcare space. Then we'll go to Becca and we'll go to Deepak. So Tyson, over to you to tell us how you do the work you do and what specifically you're looking at.
Thanks, Mike. So I'm going to be talking to you about the Open for Good initiative. This is a research project that the Center for Impact at UCLA Anderson has been working on for some years now. And what we do is we collect publicly disclosed information from the S&P 500 companies. So these are the biggest publicly traded companies in the US. And you can see here a whole list of things that we collect, which includes greenhouse gas emissions, but a lot of other environmental metrics and a lot of other social metrics. What we're trying to do with this information, and what we are doing, is to better understand corporate sustainability disclosure. The data we're collecting, we provide free that people can use. We build a dashboard, which I'll show you a little snapshot from, that people can kind of interact with. And we also produce annual reports to help regulators and community members and stakeholders to really understand the state of corporate sustainability disclosure. You can follow that QR code if you want to take a look at all of our previous reports. And I'll be talking about a report that we're currently working on, the 2025 report, a little bit later. Within this, though, and to focus more on what we're talking about here, is the healthcare sector. So in the Open for Good initiative, we build this transparency index where we're aggregating all those different metrics. And you can kind of see here all the sectors, the GCIS sectors represented in the S&P 500, and how they stack rank in terms of transparency and disclosure. Big thing I want to highlight here, this is talking about disclosure when it comes to sustainability metrics, not performance of sustainability metrics. So this is transparency. And you can see healthcare there, third from the bottom, being one of the less disclosing sectors in the S&P 500. So when we look a little bit deeper, when you look at the greenhouse gas emissions from the healthcare sector in the S&P 500, we're talking about scope 1, 2, and 3 emissions, scope 1 and 2 being direct and indirect, and scope 3 being everything else, which includes the upstream stuff, the supply chain. And you can see scope 1 and 2 for the healthcare sector, this is very much in line with what we see across the S&P 500. About 90% of companies disclose their scope 1 and 2, but you see that massive drop off to scope 3, right? A little bit over half of the healthcare sector companies, and this is actually the third lowest reporting scope 3 sector in the S&P 500. So of the other 14 sectors, 11 of them are better at reporting scope 3 than healthcare. So why does that matter? Well, when you look at the actual emissions, the actual scope 3 emissions for these healthcare companies, you can see, we're not going to go into the exact details here, but you can see that scope 3 dominates in this sector. This is, it's just so much bigger than scope 1 and scope 2 in the sector, very much dominates. When you talk about scope 3 and it capturing everything else, the greenhouse gas protocol breaks it into 15 sectors, and we actually collect that information on when a company is disclosing scope 3, which of the categories are they disclosing, or if they are disclosing. So you can see on this, it's a breakdown of all 14 as well as not reporting. And the vast majority of firms, even if they are telling you what their scope 3 emissions are, they're not giving you the breakdown there. The next one is business travel, which is very easy to calculate in the grand scheme of things. But then you get down there to around a third, purchase goods and services, or some upstream stuff, capital good purchases. But then, you know, the upstream leased assets, upstream transportation is really falling off there. So we do have some examples of firms in the S&P 500, and I'm going to show you an example now of BD, Becton Dickinson, which is a medical device company. This is one of the best, most complete scope 3 reports you can see here. I have their two largest categories highlighted here, category 1 and category 12. But you can see they went through all 15 categories and calculated a number for each, as well as highlighting the certain ones for their business that aren't relevant, that are not relevant. So they're not a franchisees, they don't make investments in this case. You can see when we talk about supply chain for Becton Dickinson, who's doing a great job reporting, their biggest scope 3 emissions portion is the purchase goods and services they're using. So that's kind of a high level overview of what we're doing at the Open for Good initiative and kind of how we can dive down into the details, both in sector and in greenhouse gas emissions, in scope 3 greenhouse gas emissions, and then in the scope 3 categories. And one last thing I wanted to leave you with, coming soon, we're currently working on our 2025 State of Corporate Sustainability Report. We're going to have a webinar at the beginning of May to launch that and talk about it in more detail. But this report, we're focusing a lot on greenhouse gas, net zero targets, climate risks assessments, and transition planning.
Great stuff, Tyson. So for all of you on the webinar today, you're welcome to drop some questions into the question and answer section. We'll grab those when we can. Tyson, a couple of quick questions for you. Let's break down healthcare a little bit more. You know, when I think healthcare, I think of generally 5 different subsectors in that space. But healthcare to some just means hospital systems, but S&P 500 aren't generally hospitals. Tell us who falls into the buckets of healthcare.
Yeah, the sectors represented in the S&P 500 are very, very broad classifications. When we're talking about healthcare sector companies here, we're using the GCIS categorization that MSCI publishes. That includes everything from health insurance companies like United Health. It includes pharmacy chains like CVS. It includes medical device manufacturers like Intuitive and BD, as well as pharmaceutical companies, you know, the Eli Lilly's and Pfizer's of the world.
Perfect. And we've talked about data and data access. Just for those of you on the call, if you work in a system or you work at a traded company or a private company, your finance teams will have subscriptions to tools like MSCI, S&P, Bloomberg, and others. You could look up some of your suppliers in those tools because many of those research firms have ESG data already embedded in them. If you want to talk about that on a separate call, we can also dig into that. So, Becca, I'd like to come to you and have you break down a little bit more about what's going on at SPLC, especially, obviously in the healthcare space. And if you could build on some of what Tyson shared, that'd be great.
Yeah, thanks everyone. So quickly about SPLC. So for the last decade, we've led a movement of purchasers and suppliers and advocates and experts across sectors to work on social and economic and environmental sustainability and procurement. And we have over 170 member organizations across the globe, including UCLA and Persephone, many other organizations in California, and folks they see here in the webinar today. And so we do a lot of things. We engage leaders with guidance and best practices, benchmarking, coaching, peer learning opportunities, recognition programs, and multi-stakeholder collaboratives, which bring together many organizations all working to tackle a specific challenge in procurement. And specifically, I'll share a bit about one of these collaboratives that we're involved in now. So the Collaborative for Healthcare Action to Reduce MedTech Emissions, or CHARM, is a initiative that SPLC convenes, and it's co-chaired by Kaiser Permanente and Vizient and advised by Accenture. And you can see here we have nearly 40 healthcare systems, medical device and equipment suppliers. We've spoken already about a few of those leaders today, BD and McKesson, for example. And we bring together also other non-governmental organizations and industry experts who are all working together to identify and test and champion innovations and best practices to lower emissions from the medtech supply chain. So we've got 2 years, we're about halfway through. And so we're seeing leaders come together, from health systems, sustainability and procurement teams with their counterparts at medtech companies. And they're partnering on some of these really complex challenges in supply chain decarbonization that just wouldn't be possible for them to accomplish alone. So I'll share just a quick snapshot on some of the participant-led work streams that are active and what their goals are for the coming year. So you can see here, we are working on a number of different topics, from exploring lower carbon product options, transitioning to durable products, this in partnership with infection prevention colleagues and sustainability teams and clinicians. We are working to scale up single-use device reprocessing programs. We're planning on an exciting large-scale aggregate virtual power purchase agreement to bring online some new renewable energy for these organizations. And then last but certainly not least, we're doing a lot to share approaches to supplier engagement, including working to simplify and streamline communication and expectations with suppliers, so that we can move together in the same direction, but with sort of less distraction and lower administrative burden. So that's a big focus of the group. And then the healthcare organizations we're working with, medtech companies who are focused on Scope 3 emissions. They're pursuing a lot of strategies that many of you all are implementing within your organizations. So we hear that they're doing a lot to assess the level of maturity of their suppliers and stratify suppliers into groups, and then establish clear expectations of commitments to sustainability, science-based targets, and then a lot of effort going into education, training, coaching, and incentivizing suppliers to meet sustainability goals with awards and recognition programs and scorecards. And then certainly embedding sustainability into contracts and regular business reviews. So that's a lot of the core work that SPLC does with our membership, and that's also a big focus of these organizations represented in CHARM. And it's exciting to see how they are comparing notes and seeing how we can kind of cut through the noise to send unified messages to the entire supplier cohort within the medtech and healthcare space, that we all want to proceed towards our ambitious emissions reduction goals. So I'll stop there.
Becca, what I'd love, if you could, is talk a little, we were talking beforehand about National Academy of Medicine Charm is one initiative, but we got others like Healthcare Without Harm. Can you just give us a sense of the ecosystem of healthcare that's out there playing in this similar sandbox?
Yeah, we're very lucky to have a lot of organizations that we formally or informally partner with, including the National Academy of Medicine. They have an action collaborative on decarbonizing the US health sector and a specific working group with a lot of overlap with CHARM members. As you can imagine, leaders from these big companies are passionate about advancing sustainability, and so they're engaging in a lot of these spaces. So that NAM supply chain group is producing hopefully a standardized survey to simplify the process of requesting climate commitment information from suppliers and emissions data disclosures. And then I think piloting a program to train suppliers as well. So there's a lot of really practical, impactful work coming from that group. And we're SPLC and CHARM, we're staying very connected with them to understand how we can leverage their tools, and then we can support similar goals without overlapping. And then yes, Healthcare Without Harm and Practice Green Health are terrific leaders in the space, and they have a climate excellence standard. And that is, again, sort of an attempt to unify and simplify a call to suppliers to meet certain requirements around public disclosure of emissions, and then starting to pursue strategies to reduce them in the second phase. But there, I could rattle off a dozen or more other organizations, including Persephone, of course, who are doing this kinds of emissions disclosure and then supplier engagement work. So we're very grateful to be in good communication with the whole constellation of organizations working in that area.
Excellent. Thanks. We're going to transition over to Deepak in just a second, but I want to touch on a couple of questions that came in. As Tyson mentioned in his study, let's say you're just looking at the S&P 500 largest publicly traded companies. He broke down and looked at healthcare for us. We saw that scope 3 is the most material area for healthcare. And we also saw that healthcare is not doing a lot of disclosure, the healthcare broader sector, right? In this area. A couple of questions came in. One was about carbon credits. What we find at Persephone, and many of you probably find, is people don't even have a really good handle on their overall scope 1, 2, and 3 calculations or their footprint. So rather than rushing into the carbon credit discussion, I think more of us need to get focused on how do we actually measure this, especially scope 3. There was a question that came in about blockchain. I think everyone out there is more and more interested in technology, AI, et cetera. Blockchain and the discussion of how it's going to help the sustainability field. It's been around for a long time. That blockchain discussion might be better suited for someone like UCLA or SPLC to move it forward in that way. If we can just go back to that slide of logos, I just wanted to show people and get people to think about this. What comes up in our conversations that we have often when we're dealing with public sector agencies is that we are often faced with this kind of unique question about small, medium enterprises. We don't even have a good handle on the entire S&P 500, right? And we're talking about small SMEs and whether or not they're ready for this. So there's a question in the chat right now about trade-offs made from financial perspective to disclose this information. Now, if you think about all the people on this particular slide of CHARM, each and every one of them has thousands of their own suppliers. And each and every one of them probably has hundreds of key customers. I think of just walking into any medical office, I see McKesson, I see Becton Dickinson, I see Stryker, and then I see all the other stuff laying around me. Now, Deepak is going to take us into a deeper dive on this at the level of LCA, but the question about is there a cost benefit aspect to this, LCA gets into the real weeds of it, right? You're going to get into some real details here. So a lot of the information that we at Persephone deal with is actually already available in the finance team's offices, environment, health, and safety teams, or the sustainability teams at arm's length. It can be gathered. And the value of this information is not so much for public disclosure and saying, look at me, I'm a good company. It comes from doing business with your biggest customers. And we'll get to that in a second. Large institutional customers are expecting you to measure, manage, and report on scope 1, 2, and 3, and have that information ready to be verified. And we're going to talk about some regulatory developments as well. Deepak, over to you for a deeper dive into what you're doing at UCLA. Deepak?
All right. Thank you, Mike. Thank you. So yeah, uh, what we are looking at is like what Tyson showed exactly, right? I mean, scope three is dominating. Scope three is comprised of many different categories, and within that, the bulk of it is in product purchase, purchase goods and services. So we are doing. We're trying to actually look at data of what a large hospital purchases in a year, and look at, okay, where is it, what kind of products, and so on. So before that, this is collaborative work. So I want to acknowledge my students here who have done some work on this. And also this is collaborative work with UCSF, who has generously shared the data. And, thanks to this being supported by the Commonwealth Fund, which has made this work possible. So, as an economist, I would first like to just share, what is the size of the sector. Forget the NAICS codes, which is just the industrial classification system codes. But what I show here is the different sectors, economic sectors that comprise the U.S. healthcare sector, right? Starting with hospital care, there's also health insurance carriers, physicians and clinical services. All of it, actually about 10 or 12 of them, cumulatively adding up to about 6 trillion worth of output or sales or revenues. And the bulk of it is actually, about a quarter of it is hospitals, about 25, another quarter is health insurance and physicians and clinical. So you can see there, where is most of the economic activity coming from. If just the 6 trillion by itself is about is the third largest in terms of GDP, only behind US and China, larger than the economy of California. And if you do it on a per person basis, it's about $15,000 to $18,000 per person worth of output. Just think about that. We all think about gas prices going up 1 cent and so on, and 10 cents, and make a big deal. This is $15,000. A 1% swing is massive. Okay. So just to keep that in mind, what it is we're talking about, and defense is only 1 trillion worth. So it's the 6 times defense, U.S. defense. Okay. All right. Scope. I'm not going to go into what scope 1, scope 2, scope 3 are, but no, just pictorially, scope 1 is your own. Scope 2 is the electricity you buy, and the scope 3 is everything else, the one in the red circles, and that's what we're talking about. And like Tyson showed, it's about 80 to 85%. Just very quickly, again, going back as an economist, if we were to put a $50 per ton carbon tax, and the hospitals were required to pay on their scope 1 emissions, it would raise the cost of services by 0.08%. Okay, less than 0.1%, because scope 3 emissions are not much at a $50 per ton carbon tax. At if you took scope 1 and scope 2 is almost twice of scope 1. It's still about less than 0.2%. So scope 3 is the bulk of it, and it's about 0.14 kilograms of carbon dioxide per dollar of services, and still it would increase the cost by 0.73%. Okay, and if you add it all up, it all still comes to less than 1%. So yeah, in the last slide I said 1% is a huge amount, but it's even a $50 per ton carbon tax is only about 1% of the cost of doing business. Okay, so it's not a big amount for the healthcare sector in terms of what it will do if you put a carbon tax. So I can't move my slides. Okay, I can now. Okay. Just to quickly, like Mike said, we have data. The UC Office of President produced a report on inventory of scope 3 emissions. It shows for the major campuses in the dark, dark green or whatever is the biggest chunk is scope 3, and for the different hospital systems that are part of the UC, you can see scope 3 is the largest share, yeah, and we are working with data from one of the centers. Okay, so there's a lag. Okay, so what is the challenge here, right? The thing is, all the estimates of carbon emissions that we have seen so far, all the businesses are producing, are based on expenditure. So if I spend $1 on this, what is its carbon intensity based on what is the carbon intensity of that sector? So construction sector spends, for every $1 it emits X units of carbon, you multiply by, I have X, $1,000 of construction, so my pollution is 1,000 times pollution per unit dollar. So that is the state of the art. I mean, that's the best we can do at an economy-wide level. It's very useful. It gives high-level insights on how much each sector contributes. But this is not very useful if you're a healthcare professional or a healthcare sustainability person. Okay, 80% is scope 3. It is comprised of purchased goods and services, is probably within that about, I'll show, I have a picture, is a huge share, and it's comprised of tens of thousands of products. So just one large hospital buys 30,000 different distinct products that come under purchased goods and services alone, which is one of the scope 3 sectors, right? So emissions is diffused across thousands of products. The product cost is a poor proxy for how polluting a product is. So you cannot just take emissions per dollar for a category like medical products and multiply and say, okay, that's what it is. It's a very poor. So I'll give you a little bit. And what is the best thing we can do is do a life cycle assessment, which is what I do. But it's time consuming, it's costly, and it requires data, which hospitals or may not have. You don't know what your suppliers are using. It's really difficult for hospitals to, and so when Tyson said that only 50% are disclosing, I can understand the predicament, right? It's very hard for them to know where is the pollution coming from. So here is actually on a cost basis, if you just look at within the hospital, if you just take the hospital sector and look, where is the money spent? If a hospital is providing $1 worth of healthcare, where is what is it buying? It's buying insurance. 6% of its cost is insurance. 5% is real estate. 2% is pharmaceuticals, wholesale trade, ambulances. You can see, right? The purchased goods and services, which is actually medical products and all that, like gloves, protective equipment, radiology equipment, MRI machines, all of that don't feature here. They're actually way below. Like the 3 things that show in the top 15 are blood, surgical, blood sugar, pregnancy kits, surgical appliances. They're adding up to 3%. So they're really small, and they are comprised each of hundreds of products. So that's the challenge we have. So just this one category is 26,000 products. Okay. And so what we are trying to do, and here's the challenge. We looked at the 25,000 products that a hospital buys, and we sorted them based on quantity. Why is quantity good? More quantity means more mass, more materials. More materials means more pollution. It's a better indicator than how costly something is. And when you sort it, actually, if you see the blue picture, just about the top 200 products by quantity explain on the left picture 80% of the quantity. So 200 products comprise 80% of your products. So that's good, because then we can just collect data on these 200 products and then go and do a detailed life cycle assessment instead of 25,000 products. So those are the kinds of things we are doing. And on the right is by expenditure, which is not a good indicator. You even go to 1,000 products on the right picture to the rightmost, you are still covering only 30% or 40% by quantity, and about 50% by expenditure. So it's a lot more work to do an expenditure-based analysis. So just one picture here. This shows actually on the x-axis the price, right? Look at the two, I don't know if you can see my arrow. There is laryngoscope blade, single-use plastic. It's about $3 or $4. On the right, you have a central venous catheter, which is like $30. They are both the same price. They're 6 times costlier. But if you do a life cycle assessment, the carbon intensity is the same. Again, look up the picture. If I draw a vertical line at $25, the catheter is like $25, and it's less than a unit of pollution. But the surgical scissors is same price, but 6 times the pollution. So this is the problem. If you rely on prices, you don't know where to put your money. So what we are trying to do is help get a better handle on these things. And our approach is to develop heuristics like this. And in this picture, I'll show that when you sort by top expenditures, the expenditure method will say, go make your implants more sustainable. It's a waste of time. Implants are extremely expensive. They're not very big. They're sophisticated equipment. They don't contribute much pollution. So you'll be wasting your time and money reducing carbon from there. Ours says, go look at personal care products, because that's what you buy a lot of, gloves and surgicals and stuff. So this is the kind of work we are doing. What are the challenges? This is my last slide. The biggest challenge we face, and we need the industry support here, is we just need better, readily accessible data on product weight, material composition. What are your products made of? I hope we are not asking for anything very intellectual property sensitive. Just what packaging you use, how much packaging you use, where do you manufacture them, and so on. If we can access this information, and if the industry can come together and create some public repository, it will be a great help to researchers like us, and we can just give you better advice on where the healthcare sector should be spending its money.
Excellent.
That's it.
Very good. So I want to ask you a couple of questions, Deepak, and I want to invite everyone here. This is your chance. We were at the 36-minute mark. We've got 24 more minutes. So this is your time to learn from three experts. But Deepak, the idea that some of these institutions have tens of thousands of products in them, right? And that's just the product inside. I'm just assuming it's a UCLA type of medical center, and you're talking that number. Then you go down to someone like a Becton Dickinson, they've got tens of thousands of products that they're buying to do what they do. We're talking mathematics off the charts here. And is this really the best way to find the most material issues? I mean, people often want to go down this LCA approach, but it's quite time intensive and quite costly.
Yeah.
How does one shortcut this to make it efficient?
That's an excellent question. This is precisely why we don't want to do an LCA of 25,000. All we are saying is, if you give us information on what it's made of, we are developing heuristics. So we can say that a product made of plastics plus steel, if it's 80% steel and 20% plastic, or 80% plastic and 20% steel, I can give you a very quick estimate of how much pollution there will be within a reasonable bound. And that's good enough. And that will help us target the top 500 most products. And across large hospitals, that is what is going to be more or less the same. It's not going to be too different. So the whole idea is not to do 25,000 LCAs. That's the whole point.
Excellent. Now, Becca, Tyson, and Deepak, I want you to listen to this story, and then I'm going to ask you some questions afterwards. So one of my heroes in this field is Sister Susan Vickers. She used to work for Catholic Healthcare West, which then changed to Dignity Healthcare, which is now part of Common Spirit and Dignity. Sister Susan is a nun. She also worked with a lot of nurses, and their mission was to do no harm, take care of God's planet and God's people. She taught me 25 years ago about sustainability because she was the first healthcare system to do a GRI report, right? As I got to know her and her team better, I started to work with her as a consultant, and she taught me more and more about the levers that she pulls. Large hospital systems have a large 401k plan because they have tens of thousands of employees. Sister Susan and her team members went directly to Baxter and said, look, your products have carcinogens in them. We have to throw these products away. We would like you to come up with a solution because we're trying to take care of our people in our community and not expose them to carcinogens. We don't want our workers to be exposed to carcinogens. Our workers live around the area too. Baxter didn't really pay attention for a while. Sister Susan and a few other nuns show up at the annual meeting of shareholders. She was a shareholder. She got together with other nuns and priests and rabbis through a group called the Interfaith Center for Corporate Responsibility. They owned enough shares collectively to be allowed in the meeting. And she got up and asked the CEO a question about this particular issue. Why can't you, as a healthcare company, do it? It's all public information. You can find it out there. Baxter lost a large contract because they couldn't come up with a solution. Another company saw that opportunity, stepped in with a non-carcinogenic IV bag and tubing product, and they won the project going forward. That's important here to think about because we're getting to a place in our market where RFPs like this one you're seeing before you are coming out in the public domain where we're allowed to see it. Now, we at Persephone see on a daily basis RFPs from potential customers that say to us, can you give me the best price, the best quality, the best delivery time? And oh, by the way, Persephone, what's your carbon footprint? And that's what Anissa, my colleague who's on here with us, that's what she does. She's responding not only in measuring our footprint, we need to walk the talk if we're selling these solutions, but she responds to these RFPs. These are B2B practices. We don't see that in the public domain. The UK government, after the last COP meeting in 2020, came back with a commitment as a nation to be carbon neutral. As a nation, they had to go out to all their different departments and agencies in the government and start to think about this. The National Health Service of the UK government put an RFP out about 2 years ago. It came to us because several medical equipment providers came racing to us saying, I need to fill this out for this RFP. I want to win this contract. I've been a supplier to NHS for 5 years or 10 years. I don't want to lose this contract. This is a market mechanism that we should all be doing more with. And I know, Becca, you talked a little bit about it. You're working on procurement policies, et cetera. Procurement policies are different than regulatory policies, and we'll get into that in a second. A procurement policy is much easier for you all listening to change. That's that moment of buying something when we all have the most power to say, I love what you're providing me, but can you show me a little bit more detail? And the fact that Tyson was able to show us that Becton Dickinson story to the level he did lets us all see that some companies can do this and are doing it ahead of time and are prepared to answer these kinds of questions. So the first question goes to you, Tyson, in the sense of that BD data that you showed us, and if you want to go back to it, you can. How did you get that, and how can all of us get that level of detail? And what other questions should we be asking of people like BD that are in our supply chain?
So in the Open for Good initiative, we only collect publicly disclosed data. So this is BD themselves saying, here's how we break down our scope 3 emissions. Sorry, what was the second part of your question, Mike?
So you didn't do additional research on these numbers. You just accepted what BD was saying in the public domain.
In the public domain. But what we're really interested in is, why does BD go to this level of detail where some of its peer firms may not in some cases, and between different sectors and not. And as Deepak highlighted, some it's going to be easier than others. And even within the categories, if you just scan down these, something that's really going to be big for a bank or McDonald's isn't really going to apply to BD.
So let's say I'm a hospital system, one of the 5 at the University of California, and I'm going out for my next round of RFPs. I could start to ask these questions very precisely in an RFP. I could say, can you fill in category 1, 2, and 3 with numbers? If you can't, that's fine. And there's no reason you can't ask that question as a buyer. Am I correct? Or, I mean, that might be above your pay grade, Tyson, for procurement, but
that is above my pay grade. But this is all attainable. I think that's kind of with your question. It's all doable. Yep. As Professor Rajagopal pointed out, it can be really hard and time consuming, and there's a lot of ways you can do it more accurately and more precise, and less accurately and less precise. But again, this is a guide. This is a tool we can use to say, where are the hot points within a firm, where are the hot points in a product or a supplier, as opposed to this is some exact calculation that contributes to annual CO2 in the atmosphere.
Yeah, good point. Now, we will share this deck and this recording with all of you. We're going to throw in some more resources in the chat function so you can have hyperlinks to certain resources. Becca, I want to come to you next. And if we can go to that slide where you had all of the things you're doing, it is slide 18, engagement strategies. I would like to talk more about that procurement piece. It's one thing to get a bunch of these institutions together and talk about procurement. I know from my own experiences, the next slide, 18. The next thing is, where do we go in the way of actual engagement with suppliers, right? Now, if I'm SPLC or I'm Kaiser Permanente or anyone, I don't have time to read 14 paragraphs worth of qualitative things that you're doing. I just want some simple numbers, preferably. And that UK NHS story is unlike anything I've seen in my 30 years in the career. How do we just get to numbers, and where is SPLC taking this journey so that we just get to some numbers?
Yeah, I think there's a real tension, creative tension that we're exploring on the call, because of course, LCAs are our gold standard. We don't want to be misled by spend-based data if that takes us in the wrong direction. Yet, as Deepak beautifully put, we can't do 25,000 LCAs. So I'm really eager to see some of our partner organizations like NAM, I think, put out some guidance on how might we create templates for product level data requests, because those can be really dizzying in their number and specificity and variety. But I think in the spirit of kind of not letting the perfect be the enemy of the good, I think it's great to have these very simple, accessible, and hopefully standardized requests for very basic climate commitments and high level estimates of scope 1, 2, and 3 emissions as a starting point. And then follows the coaching, education, training, peer-to-peer learning, supplier summits that we see a lot of our SPLC and CHARM members doing to bring people along wherever they are starting out.
Excellent. Very good. And Deepak, there's a question that came in to the Q&A area. I don't know if you're able to see it or not, but
yeah, okay, I can just, okay.
Yeah, the level of, kind of the cost benefit. You've said we don't have to do 20,000 LCAs. We're not going that route, but it is helpful for an institution to understand the material aspects of their footprint. Can you help us understand a little bit more about how does one identify these things? I mean, you even pointed out insurance as being one of the top areas, but no one's really talking about insurance amongst the hospital disclosures and healthcare disclosures that I see.
Right. No, I think this is a great question. I actually am very aware that LCA is very costly. We don't want to create a huge financial burden or create an army of accountants or who hospitals have to pay now to do these things. So that's precisely the thing, is to make sure we do it. We target the most important things in the things that make an impact without adding too much. Don't create too many reporting challenges and going into it. That's precisely the endeavor that I'm interested in, is to minimize. So here's the two things I said, right? One, as a cost of doing business, you can put this thing, right? If you put $100 per ton carbon tax on the health sector, it should not increase your health costs so much. At the same time, I also said healthcare is a huge cost. So any small increase in costs, people may say, why are we wasting here? So that's the tension there. We have to reduce costs where we can. And that's where all this in the insurance stuff, all the wastage stuff, and you do cost savings there. At the same time, we have to, because I think the thing about this is also that it minimizes wastage. It can be a win-win for the hospitals. It can actually help reduce the amount of stuff you use and throw. I mean, the amount of wastage you will see is tremendous in hospitals, right? So this can be one of the useful things of LCA, is to help you identify, do the same service or better with less. So even if you spend a little bit, hopefully it's not much, that should yield cost savings, because the whole thing is a lot of the cost savings are going to come through reduced need for disposable stuff, better durable materials, and so on. So that, I mean, without it, yeah, we are missing. The biggest impact is the carbon impact is going to end up being secondary. The primary impact will be, it will reduce wastage and reduce costs, and it should more than compensate for what you pay to do the LCAs on a small scale or on a limited number. So yeah, that would be my answer. It has to yield cost benefits.
Yeah, totally understand that. Along those lines, I was at a Greenfin conference last year. Greenfin is an offshoot of GreenBiz, and it was the first time I ever saw a healthcare representative. His name's Rob Roy. You all might see him out there in the marketplace, but his title is Chief Investment Officer for Advent Health, right? And he was on stage talking about the footprint of a healthcare system. The biggest part of his footprint is scope 3, purchased goods and services, and financed emissions. And I don't see any other healthcare system talking about financed emissions. And that kind of gets to your insurance piece earlier, Deepak, and this whole kettle of fish that we're not even looking at. And it's the biggest part of the footprint. No criticism to healthcare systems, but you all do procure a lot of things, everything from food services in the cafeteria to the removal of waste at the back end. Those are all purchased goods and services. In that RFP process is the most powerful moment to create a table like that NHS document that I showed you. And we'll go back to that in a second. We're going to talk a little bit about some regulations in California. It's 9:50 now. I see a question coming in. It's a bit long to read off to you, but anybody there, Becca, Deepak, or Tyson, you want to plug in on that, please feel free. But thanks, Jamie, for writing in about that. So I'm going to flip around to a couple of other slides. I'm going to editorialize a little bit. Welcome to take some more questions in the Q&A area. and want to then think about all of our call to action, right? 20% of our GDP, depending on how you want to look at it, World Economic Forum or other data sources, 20% of our GDP in this country is made up of healthcare, right? Now, I put quotes around healthcare because it's just something we all do, right? But even we in the healthcare space sometimes say health and care as two separate words, and sometimes we put it together. We're not even standardized always in the way we talk about healthcare. As Tyson mentioned, the way S&P is looking at these things, healthcare is bucketed in a certain way. Deepak mentioned the NICS codes approach. That's a different bucketing of healthcare based on the way people put these criteria together. Now, you and I have seen some slides from Charm. We see a bunch of logos. That's all great in what they're doing, and they've got the entire value chain lined up there. And in that value chain are private companies like Accenture, who's sponsoring it, is not a publicly traded company. So they're reporting themselves on their own footprint as a service provider. Kaiser is a nonprofit healthcare system. They report on their footprint in different ways. But because of these two institutions being independent and different than publicly traded companies, they're not required to do this kind of thing, right? Now, we were in this field. We were hoping that the SEC rule would do something here in the US, but that's pretty much gone, right? But the state of California, being the 6th or 7th largest economy in the world, has been working on its own requirements and regulations over the past few years. And so we at Persephone, along with a number of our friends, been closely involved with Senate Bill 2553, 261, 219, and the latest one is 755. Senate Bill 755 is in process right now and is something that you all might want to pay attention to. Simply put, 253 and 261, if you're a certain size of an institution doing business in the state of California, you will measure, manage, and report your greenhouse gas emissions according to internationally accepted approaches, meaning i.e. the Greenhouse Gas Protocol, and you will report risks in accordance with things like the TCFD, right? And you will have certain parts of your information verified by a third party. I asked Tyson about that with the details he gave us about Becton Dickinson, and he didn't go any deeper than what Becton Dickinson had shared. Now, if you're a real discerning buyer, you might want to go to that supplier and say, I can appreciate what you did, but can you pay for a third party to verify your information before we accept your bid? And that is going on. The NHS RFP example I'm showing you right there talks about that. And if you get the actual document from the UK government, you'll see greater details. Now, they're not saying you're going to be disqualified for not having the information verified by a third party, but if you're one of 10 suppliers competing on that bid, and you're Becton Dickinson, Stryker, McKesson, any of those brands you saw on the Charm slide, you're probably looking over your shoulder wondering, I wonder what my competitor is going to be doing, right? I want to beat my competitor not only in price and quality and delivery time, but on my greenhouse gas emissions information. So that's where things are going. And they are already going there right now. So it touched a little bit on 755, which I'll unpack in a second, but Becca, Deepak, Tyson, anything you would want to add as we're getting to the 5-minute mark? From your perspectives, what you've heard today, what you've heard from each other, anything you'd like to clarify or bring up?
I would just add to your comment, Mike, about assurance. We do see a lot of S&P 500s seeking assurance of their greenhouse gas emissions data. It's something the big four will do for you now as a lot of smaller boutique engineering firms. They are doing limited assurance, so it is checking the math. But still another third-party verification of that. I will say it does fall off, kind of like we saw with Scope 1 and Scope 2, then Scope 3. For a lot of these companies that we're seeing now in their reports, they're doing assurance on Scope 1 and Scope 2, but not yet on Scope 3. Again, much more complex and harder to do, and you kind of scale up that way.
Deepak?
I think this is very important, but we really need to make sure with all these reporting regulations and stuff, we are smart. It should not create a huge burden to track all these things. So I think we need to invest a little bit and make it a little bit effort in collecting the data and doing a little bit of research and developing methods so that we help the people who want to do the right thing put their money in the right place and target. I think targeting where in purchased. See, the EIO is very good. Don't get me wrong. That per dollar emissions is very useful to identify scope 3 as 80%. Even if you do LCA, you're not going to find scope 3 is only 10%. No, it's useful at that level. But if you want to go within scope 3 and then within purchased products, we need to do slightly better than just looking at the cost of a product, which is the only thing we have today. So that's what I would say is to, yeah, not go the full extreme LCA of 25,000. So it's going to be a balancing act and making sure also the reporting burden is not huge on hospitals whose primary job is to make sure they provide good healthcare. And so otherwise it's like growing organic tobacco and saying I'm sustainable. Right? Tobacco will still kill if it's organic or inorganic. So.
Yep, good point. Becca, anything you'd like to close with before we wrap up?
No, I mean, I think I'm glad to know that there are countries abroad and states like California that are carrying the torch of sustainability in procurement and continuing to set regulations. Even, as we experience some regulatory and market tumult here in the US. But I think the other thing is, many of the organizations we've talked about today, they're not only motivated by regulation, of course. And I think to your story, Mike, about Catholic health systems and visionary nuns leading the charge of environmental stewardship, I think it's wonderful to remember that this is also about, coming back to mission, aligning with the values of providers and employees and community members, certainly saving money, reducing waste, risk mitigation and supply chain resilience is certainly a big motivator. And I think some of the framing that a lot of our organizations are turning to as we continue the work in a sort of different environment. So wonderful to have regulation be a backbone. And it's also encouraging to see how many leaders are motivated by many different factors to continue full steam ahead.
Great, thanks for that. I see a number of questions come in. We'll try to tackle those maybe offline as we flip to the final couple of things we want to share. Because of the way that we told the story today and what's been happening in the market and that we're tracking very closely, we started to look at what was happening in California under the California Senate Bill 755. We are also working with governance and accountability to do a deep dive on the suppliers to the state of California. This is like the White House counsel's work with the General Services Administration, publicly available information in publicly available databases that we can all access, but they're not very easy to understand. So partnering with the Governance and Accountability Institute, we did a deeper dive into suppliers based on spend to the state of California. Senate Bill 755, if passed, will require some of these suppliers to step up and measure, manage, and report. Healthcare is one of the big sections of spend for the state of California. The other sector is construction and real estate related. Now we're rebuilding in LA because of the fires. There's a lot of construction up and down the coast just for highways and buildings, et cetera. Our own state California government buys construction services for the universities in some cases and for other public sector institutions like counties and cities. So construction is notoriously made up of private companies that may or may not be doing a lot of measuring, managing, and reporting. Construction and real estate also has its own representative body, U.S. Green Building Council, and many others that are working on these issues, much like SPLC is working on procurement. So that will be our next webinar. But I want you all to go away thinking about this because we all are taxpayers, most of us, and we all buy and we all work at institutions that buy. And scope 3 is still the biggest mystery for all of us. So we can't be running around talking about carbon credits when we don't even know what scope 3 footprint is of our institution, in my opinion. And we can't be patting each other on the back for how great we are unless we really know what's deep in the weeds in scope 3. So with that, we're at the hour. I want to thank Deepak, Tyson, and Becca for being with us, Anissa and Teresa for helping us sort this out for version number 2. We'll get the recording out to all of you, and thank you and have a great day.